Hello, ladies. Hope your week has started off well. Just pulling out my phone to make sure that I am live and I see myself, which is a good sign. And I wanted to pull that up in case I had questions, because my last live unfortunately did not show the comments. Good sign. Which is frustrating. And I wanted to pull that up in case. I'm hearing myself. Hold on one sec. All right, so now I can monitor the comments and look for anybody who joins live. If we don't have anybody join live, that's totally fine. Mom life is hard, mom life is busy, so that is why I like to do these trainings so that I can post them for you in the group later on so you can catch the replay and get all of the amazing goodness when you are able and when you can find some time to actually sit and listen. So, as a means of quick introduction here, we've had a few new folks join the group this week. So welcome for those who don't know me, who are new to me. My name is Jessie Sletton and I am a postpartum empowerment coach. And my passion is to help moms exchange surviving for thriving through holistic recovery plans focused on nourishing, healing, and bonding in postpartum, and planning for that in pregnancy. So I really work with moms throughout the entire perinatal time frame. And it is my joy, it is my passion, and I absolutely love what I do. I offer one-on-one coaching services that are tailored and individualized to each mother that I work with. And so I work with these moms one-on-one to create their personalized recovery plans based on their pregnancy experience, based on their birth experience, based on their postpartum. All of those things are taken into account, and we work through and create a plan that helps you feel empowered, that makes your healing, your well-being front and center to your postpartum. Because when we take care of ourselves, when we ensure that we are healing properly and we are taking in, the most nutrient dense foods to help our replenished system, or our depleted system replenish again, then we can show up as more attuned, more present, more more gleeful, more happy, more joyous moms and partners. It is so important for us to be able to make sure our cups are full before we can fill those of the ones that depend on us most, right? And so that is what I do. I am a one-on-one coach and I'm also a certified lactation counselor. So on Mondays, we discuss all things lactation. It is one of my favorite things to geek out and nerd out on, all right? Some people have their things. Mine is about lactation. It's weird, I know, but it's pretty cool. It's a pretty cool process. So I am very passionate about bringing evidence-based information to you all because there is a lot of misconceptions, a lot of inaccurate information that floats around the interwebs about lactation and the breast or chest feeding process. So on Mondays, we try to clear the air and educate about anything to do with the lactation process. So welcome for those who are joining us live. Let me know you're here. Drop where you're coming from. If you watch the replay, let me know, #replay in the comments. And if you have any questions about the material we cover at any point, please feel free to drop a comment. And if you watch the replay, I will also come back and answer those questions. So let's dive in after that introduction. So today's Milky Mama Mondays topic is more of an anatomy type discussion. So I'm going to be doing some of these in the upcoming month where we kind of talk about the different parts of the breast and how their function works as far as the lactation process and some other things that go along with that. And today's star of the show is all about the areola. All right. So, for those of us who don't know, I want to kind of get high level and then I'm going to get kind of down into the nitty gritty here about the areola, the anatomy. We're going to cover the function in the anatomy. We're going to cover the size, color, and shape variations of the areola, as well as the breastfeeding impacts and challenges that can come along or impact the areola during the lactation process. So the first thing we're going to talk about is the function and anatomy of what the heck the areola even is, okay? So the areola is actually the darker area surrounding the nipple on the breast, okay? I will, for demonstration purposes, pull out one of my handy dandy breast models. And I like this one because I can kind of show you the darker area here would be considered the areola, okay? And I love this breast because it is actually demonstrating an areola that is of the larger variety, all right? We're gonna get more into the size, shape, and color in a minute, but I was happy that this was the one that I grabbed because we're gonna be talking about that, what's normal, and what variations we can see. Everybody's breasts are unique, right? All right, so now that we know what the areola is, let's talk about some of the changes that we can expect in pregnancy and postpartum, okay? I said in my little blurb on this video that, you know, breast areolas aren't usually top of mind daily for us, right? And we kind of really don't even pay attention to them until something kind of looks different, right? And that is one of the first things that we can notice change on our bodies in early pregnancy. All right, some research has even shown that as early as a week or two post-conception, our areola skin can start to darken and we can actually start to notice these changes, okay? I'm very curious, this might be kind of a personal question, but if you are watching this video, I would love to know if this was one of the first signs for you, for your pregnancy. It was for me. It was one of the first things that I was like, that's a little different. What's going on here, right? Along with some of other stuff that we can experience early on early on in pregnancy. So let me know if that was something that you noticed for yourself in your own experience. We can also start to see changes in the actual thickness of the skin of the areola as well as the size, okay? Our areolas, for many women, do change in shape and size and color in pregnancy and in postpartum and throughout the breastfeeding experience, okay? And these changes are, of course, all driven to, can you guess it? Dun da da, hormones, like everything in pregnancy, right? So all of these hormonal shifts that are happening within your body due to your pregnancy create these changes in your breast. There's so many changes that happen in your breast beyond just the areola, but that's all we're focusing on tonight. So a little bit more on the microscopic look at the areola when it comes to the anatomy. Another important piece that we need to discuss is called the Montgomery tubercles, okay? Or you can hear these called glands because that's exactly what they are. On the areola skin, you may notice little tiny bumps that are very similar to kind of like the look of a goosebump, just very kind of small little lump or bump that can start to form or become more prominent. They've always been there, but in pregnancy they become more prominent and they actually become raised for a lot of women. And these have a very important function, okay? So the Montgomery glands, they actually produce a oil that is really neat. It's got a lot of different functions and they're still kind of studying some of this as well in the research. But they actually are believed to produce a scent in the oil that they produce that can actually attract a nursing infant. So just as it's believed with the darkening and the reason for the darkening of the areola, as well as the scent that can be produced by the Montgomery glands, is thought to all aid in making breastfeeding more efficient or more easily done for the infant, where they're attracted to that. They can see the nipple easier, they can find the nipple easier through the smell and the visual of the darkening of the areola. So back to the Montgomery glands specifically, not only do they produce that oil that has a scent, something interesting about this oil too is it helps to lubricate the nipples and to keep it supple and keep it from getting too dry, which can happen a lot, right? When either you're in a drier climate or just the nursing process itself can be pretty stripping sometimes. So it helps with that, and it also is believed to have some antiseptic properties as well, which is very interesting. So that is kind of the major anatomical pieces to the areola. We talked about just it's the larger darker skin surrounding the nipple area, and within that area, that skin is the Montgomery tubercles. So now that we've talked about the anatomy and the function of the areola, let's get down to talking about the size, color, and shape variations. As I mentioned, every woman's body is unique, okay? Every woman has different breast sizes. Some might have one breast that's larger than the other. Some women have, same thing for their areolas, okay? Some women have smaller areolas, some women have quite large areolas, and all of this is normal, okay? All of this is normal. During pregnancy and postpartum, like I mentioned, we see that the shape and size and color can change and shift. I did want to mention pre-pregnancy, there's been some research to kind of look into what's the average size of a typical areola, which is kind of an interesting topic for research, right? But a couple of the ones that I was able to find, 2009 in Japan, they did a study, and they found that the average diameter of the areola to be about 4 centimeters. So that's very, take it or leave it, right? It's one demographic, and it was a smaller study. I believe there was only about 300 women in this study, and this was pre-pregnancy. So about 4 centimeters. And then there was an older study done in, I believe, Israel, where they found that the average areola size to be about 3 times as big as the diameter of the actual nipple. Okay, so these are all averages, and take it or leave it, but it's just kind of interesting to know that. And like I mentioned, some women may have much larger or much smaller areolas than this, and it's all perfectly normal. Some shapes that we can see is obviously circular. Some women might have more of an oval shaped areola, and that can actually change as well during pregnancy. Not just the color or the size, but the actual shape of the areola can change. There's all variations of normal within this, okay? All thanks to those wonderful hormones. So, I wanted to mention too that some women don't experience any of these changes in pregnancy or postpartum, and that can also be very normal. Okay, so if this was something you didn't notice or you didn't experience during your pregnancy, it's important to know that that does not mean that it's any sort of indicator on how your breastfeeding journey is going to go, okay? That just because perhaps your areolas did not change and you did not experience that, it does not mean that for that particular reason you're not going to be able to have a successful breastfeeding journey, okay? There is no correlation there. So let's see, make sure I'm checking my notes. I don't think I missed anything. Sometimes I just start talking and I forget about what I actually wrote before the call. But I think I did mention everything. The one thing I was going to say before we move on to the breastfeeding impacts and challenges is that typically after your breastfeeding journey ends, a lot of women do find and notice that their areolas do go back to their pre-pregnancy state as far as shape and size and color goes. But for many women, it is actually something that may change more permanently. And they may actually experience that once they can discontinue breastfeeding, that their areolas remain a darker color, or maybe they remain a slightly different shape, but maybe they've gone back down in size. So that's all very normal as well. And it's not just in pregnancy and postpartum where we can see changes to our areolas. Because it is hormonally driven, we can also see these and experience some of these things, maybe not as drastically as in pregnancy, but in things like menopause, even our menstrual cycles, all of those hormonally driven things, and aging in general can also cause changes to your areolas as you move through those. And there are some indicators on when things are not normal and when you should talk to your doctor. It can be a little bit tricky to identify these during a huge hormonal shift like pregnancy and postpartum. But if you are noticing a very drastic difference in one areola and not the other, that is something that you want to bring up to your doctor. Anytime you have any concern over the appearance, or especially the sensation maybe that you're having, if it's not normal, if it's painful, those kind of things are all times when you should speak to your healthcare provider, okay? And make sure that you're doing regular exams as well. All right, so let's move on to the last little bit here, the breastfeeding impacts and challenges that our poor little areolas can face sometimes when we're going through our lactation journey, right? And very similar to what our nipples go through, but the most important thing to make sure we're staying on top of is a proper latch when it comes to breastfeeding and your infant. Many damaging things can happen to our areolas if we aren't focusing on our latch each and every time. We can find abrasions that can happen, cracks, soreness, all those types of things, increased risks of milk blebs. All of those types of experiences can arise if we aren't focusing on our latch or if we're struggling with that. So always break an uncomfortable latch and seek out help and assistance if you are struggling with that and it's consistent and you're experiencing pain outside the first few seconds of breastfeeding. Breastfeeding should not be painful. I will say that over and over and over again. All right, some other things we can experience, cracking, irritation, or infection. With the leaking that can happen in pregnancy and in postpartum when we are breastfeeding. It's very important to make sure that we are keeping things dry and when it comes to milk and your breast pads, okay? Make sure you are changing those out if you are leaking significantly enough to need to use breast pads. Be sure you are changing those out frequently so that you can reduce your risk of things like thrush that can occur when we aren't doing that and we're letting things kind of sit on our skin. It can cause all sorts of issues and irritation as well. So make sure you're changing those out. Another thing that you might want to try to do if it's possible is really letting your nipples and areolas dry right after breastfeeding. Allow that milk to kind of just sit and dry on top of the nipples, and it's also very moisturizing as well. And that also allows the lubrication from the Montgomery glands to be able to actually kind of soak in and do their magic and their work if you aren't just constantly trying to wipe right after and putting a breast pad right on again. That allows it to kind of do its magic. And the last thing that we can experience, just like with our nipples, it's all related, right, is with engorgement. Sometimes the skin of the areola can get quite hard, stretched really tight, and be painful, right? And that can flatten our nipple and make our latch for our little one very difficult. And that can lead to other really unpleasant things, including, clogged milk ducts, and mastitis, all of those types of things. And of course, an improper latch can also occur as well from engorgement. So it's really important to stay on top of those things. Make sure you're draining your milk as much as possible. and making sure that you aren't overstimulating, all those kinds of things. All of this is stuff that you can work through with creating a lactation care plan with me, since I am a lactation consultant, or somebody else who is trained can help you and assist you with that as well. All right, ladies, so that was all about the areola. I did not see any comments come in. I just want to make sure really quick because, like I said, last time I missed them, but I don't see anything. So if you do have comments after the fact, drop your hashtag replay and then let me know what your questions are. And anything else, maybe some takeaways that you didn't know about, something that you learned, I'd love to hear it. Otherwise, I will see you all live again here on Friday for Free Coaching Friday. Remember, we did have a time change. The training is now at 11 a.m. Mountain Standard Time. And that will be right here in the group. It's a chance for you to get coached on anything specific to your postpartum experience, or in general, things that you're looking for guidance on. It's a time for you to pick my brain and to be able to get that support that you need. So be sure to join me on Friday, and otherwise, I will see you all around in the group, and I hope you have a fabulous rest of your week. I will see you all very soon.